Hello, my name is Samuel Carnes, and tonight I would like to discuss with you the benefits of the foreskin and the problems with circumcision. This is meant to be a very brief overview of the intactivist's position. An intactivist is one who speaks out against circumcision and tries to promote the normal state of the penis, that is, with the foreskin still firmly attached. Uh, there are quite a few reasons for remaining intact and quite a few reasons against circumcision. But there, in the United States, there is a lot of misinformation that is spread. And so I'd like to clear up a few things. First of all, I'd like to say that I have done a lot of research on this topic throughout my master's in health science program. I am also intact myself, and so I have the personal knowledge and experience. So the two main points I would like to talk about tonight are about that circumcision violates the principles of medical ethics and that there are no medical reasons for it, despite the hype. First, let's talk about the the ethical problems. Healthcare ethics has four basic principles. These are autonomy, beneficence, non-maleficence, and justice. Circumcision fails all four of these. Circumcision fails autonomy because the one to whom the foreskin belongs is not allowed to make the decision. Circumcision fails the principles of beneficence and non-maleficence because good is not done to the patient. Healthy tissue is removed and its function is destroyed, thus causing harm. Isn't the first principle of medicine, first do no harm? Justice is violated because an important part of a boy's penis is removed from him forever without cause. And so his right to bodily integrity is denied him. Other reasons that people give, such as looking like his father, not liking how an intact penis looks, or that they don't want him to be teased in the locker room, are also insufficient reasons. They have no scientific merit. As for teasing, boys tease each other for all sorts of things. It's far better to teach a boy to be proud of who he is and have self-confidence rather than to alter his body because of a potential bully. This is letting the bully win in the worst possible way. As for the medical reasons that people claim, many people in the United States believe that circumcision reduces HIV by 60%. This has been widely broadcast throughout the news, and many people take it for granted. But this is completely false. Let's look at the statistics for circumcision and HIV between the United States and Europe. In the United States, around 80% of men overall are circumcised. In Europe, this number is less than 20%. And now in the United States, for HIV, the incidence is 0.4%. In Europe, for the most part, it fluctuates between 0.1 and 0.4. So we can see it's either equal to or less than the United States. When we look at the other list of diseases that people claim circumcision helps prevent, such as phimosis, UTIs, STDs, penile cancer, and balanitis, we see similar results. Europe is not having a bigger problem with these. One would think that countries that have a lot more foreskin, such as Europe, would have a lot more of these problems if foreskin was really the culprit, but it's not. Furthermore, there have been studies that show no difference between circumcised and intact men when it comes to HIV, and there's been studies that show that intact men actually have a lower incidence, but yet these are not getting published in the news. It doesn't fit in with the popular cultural bias that exists. Another reason people mention is hygiene. Circumcision does not improve hygiene. In fact, an intact penis is quite simple to clean. For an infant, one wipes the outside of the penis from base to tip. That's it. In an infant and young child, the foreskin is fused to the glands as a fingernail is to a fingernail bed. You don't force it back and try to clean under it. This opens it up to bacteria and other things of that sort. The foreskin is there to protect it. As a boy grows and matures over the course of years, the foreskin gradually detaches itself and becomes retractable. By puberty, if the boy has become retractable, he can, at that point, begin to retract his foreskin and rinse it with water only. Never use soap. This is damaging because it changes the natural pH balance that is necessary for good health inside the foreskin. And in conclusion, circumcision violates all 4 principles of medical ethics. There are no medical reasons for it, despite being widely proclaimed by popular culture in the United States. The rest of the world knows the truth of these things. In fact, the Royal Dutch Medical Association calls circumcision a procedure in need of a justification. I ask that you consider these points and that you research the benefits of the foreskin and the harm caused by circumcision. We must all work together to try to end this practice in the United States. Those of us that are intact need to speak out of, what a great thing it is to be intact and to be proud of it. Those that have been circumcised need to speak out, of what was done to them and how they are not happy that this was done. There are men that are restoring and trying to gain back what is lost. There are mothers who instinctively know they don't want to cause their children harm. There are mothers who didn't know any better and now regret having fallen into the common practice in the United States. But all of us need to speak out and tell our story and try to eradicate the ignorance that surrounds this topic. The more we talk about it, the more people will become aware. There are far too many people out there who still, assume it's a boy, has to be done. And we need to tell them that actually, in fact, it doesn't. And so we need to continue and work together to spread this message to everyone that we possibly can. Thank you.